another Process 23 presentation where we help you build the DNA of your business. I'm Andy Goldsmith, and today I want to talk to you about running lean meetings. Have you ever been in a meeting that seemed like a waste of time? Do your meetings turn into bitch sessions? Do you ever leave your meetings and wonder just how effective they were? I sure have. Yes to all the above. And I learned some tips that I want to share with you today to help you run more effective lean meetings for your practice. Meetings don't have to suck. Don't suffer from what David Grady calls MOS.
MOS, mindless accept syndrome. The primary symptom of mindless accept syndrome is just accepting a meeting invitation the minute it pops up in your calendar. It's an involuntary reflex. Ding, click, bang, it's in your calendar. Gotta go, I'm already late for a meeting. Meetings are important, right? And collaboration is key to the success of any enterprise. And a well-run meeting can yield really positive, actionable results.
Team meetings are essential to a well-organized and highly functioning team. A well-run meeting can produce great results, but often meetings run late, don't have an agenda, and they don't accomplish much. So how can we run meetings that accomplish our goals and help us to achieve more? Here are my 7 rules for running a lean meeting. Keep in mind, you need to be intentional with your meetings. Set your meetings up for success. Don't just show up. Don't just let them happen. Set them up for success. Number 1, have an agenda. You open yourself up to a very disorganized and hectic waste of time if you don't have an agenda. I like to be sure that there are several copies of the agenda on the table, so anyone can see what we are covering. Oftentimes, I will even produce the agenda the day before so that they can see exactly what we are covering. Number 2, somebody needs to be responsible for running the meeting. If you have somebody on your team that is a great facilitator, then have them be the full-time facilitator for those meetings. Otherwise, the meeting needs to be facilitated by you or the office manager, because rotating around facilitators just for the sake of sharing the wealth is not an effective use of time. It needs to be somebody who has that as one of their strengths. Have a project management board. On this board, we write down tasks and assign an accountable person, a person accountable to that person, and a date when the project will be completed. An example of this is if a topic comes up in a team meeting that we need to deep clean all the operatories, we assign that task to somebody. We write it down on the project board, and then I look to the group and I say, who's going to be accountable for this project? Mary raises her hand and says, I will. I say, great, who's going to hold Mary accountable? Sue raises her hand and says, I'll hold Mary accountable. Great. I look at the two of them and I say, Mary and Sue, when will this project be completed? And they say, May 25th. Great. We write it down on the project board and we move on to the next topic. That project board stays in the office where everyone on my team can see it. It's not for patients to see, so it's typically put in a place like a team lounge or a locker room or in the bathroom or on the back door. But I want it in a place where everyone can see it at all times. And especially this is helpful if people miss a team meeting. They can see what sort of projects are coming up where they may need to pitch in and help out. Limit additional topics. I don't like opening up meetings with the phrase, does anyone have anything else they want to add? That's when you open yourself up to failure. I limit additional topics 24 hours before the meeting starts. So if you want to bring up something additional, you better do it the day before, otherwise it doesn't get brought up in the meeting. Have a note taker. Have them email the notes to everyone after each meeting, and this is especially helpful for people who miss the meetings. So often now, there are many large group practices where people are spread out on their schedules. Some people only work mornings, some people only work certain days of the week. They may miss a team meeting. It's essential that they get the notes from the meetings so that they can stay abreast of what's happening with your team. Plus Delta. This is an evaluation. It's a formulative evaluation process that provides feedback on an event. It's based on improvements. The way this looks is at the end of the meeting, with about 1 to 3 minutes left, I say to everyone, what was great about this meeting and how can we improve it for the future? That's it. It gives me instant feedback on ways to improve the meeting and lets us focus on what was great about the meeting. Finally, always finish on time or early. This is essential because your team needs to know that they're not going to always run late with their patients after a team meeting. They need to always know that they can count on the fact that they'll have 5 minutes or 10 minutes after the team meeting to brush their teeth and get in there and set everything up for their next patient. This is an important part of running a lean meeting. So a few additional tips. Review action items. Towards the end of the meeting, review any additional action items that have been added to the list. Preview the next meeting. Hey everyone, I just want to let you know the next meeting is going to be May 25th at noon. I know we normally meet at 1, but the next meeting will be at noon because we're bringing in a lunch and learn right after that. So it's actually going to be a 2-hour meeting, but we will do our team meeting at noon on May 25th. And then after you preview the next meeting, make sure that you're compartmentalizing all of your team meetings. And what I mean by that is if you're doing a potluck or if you're ordering lunch for everyone, make sure that that piece does not interrupt your meeting at all. So if people need to take a couple minutes to grab their sandwiches out of the box or figure out who ordered what for lunch, make sure that that's scheduled into the meeting. Schedule 10 minutes before your meeting even starts so that that can be a separate event. Let people know that our team meeting will start at exactly whatever the time is, noon. Our team meeting will start exactly at noon and it'll be done at exactly 12:25 or earlier. So compartmentalize your meetings to make them more efficient, more effective, and leaner. So the 7 rules: have an agenda, have a facilitator, have an accountability board or project board, limit additional topics, take notes, review the plus delta, and always be on time or early. I hope that this helps you to run a more effective and lean meeting for your practice. Join us for more Process 23 teachings and make today great.